Every day, thousands of people work to protect the health of humans, animals, and the environment. Their efforts are crucial to preventing zoonotic diseases, which can be transmitted from animals to humans. While prevention is essential to avoid health crises, making it sustainable remains a challenge. Efforts are often fragmented across sectors, regions, and disciplines. Sharing data is essential for prevention, but when information is not connected, we lose opportunities to act decisively, from scientists to civil society and policymakers, to transform collective knowledge into preventive action. This is why PREZODE initiative is building an international platform, a collaborative space designed to connect science and society, turning local actions into coordinated global solutions. The platform will make this possible, allowing us to visualize. Through global maps, the platform makes prevention visible by showcasing ongoing projects, revealing opportunities for collaboration, reducing duplication, and enabling rapid mobilization in the event of a health crisis. Connect. Through a collaborative, multilingual interface, the platform links communities and stakeholders with scientific expertise to co-design solutions grounded in local realities. Act. Through a shared data space, the platform supports the use of multi-source data to inform early prevention and evidence-based decision-making. This platform is a living ecosystem. It only works if people actively contribute to it. Join the effort. Share your projects and your data, and contribute to building prevention together, because prevention matters. The PREZODE platform, preventing zoonotic diseases together.
As ecosystems are disrupted and wildlife is threatened, new diseases emerge from animals and spread to humans. COVID-19 was the first major pandemic of the 21st century. Maybe not the last. The way to stop this is prevention. By reducing risk, enhancing community-based surveillance, and enabling early detection through a One Health approach, balancing human, animal, and ecosystem health. This is why PREZODE exists. We are a science-driven, inclusive, and impactful initiative, bringing together diverse expertise from local communities to major international players. Collaboration, scientific cooperation, science to policy decision, and data sharing are key to a healthy planet. Prevention is the most cost-efficient way to protect all health. Meet PREZODE.
Every health crisis tells the same story. By the time emergency systems are activated, the damage is already done. Lives lost, economies disrupted, budgets stretched. For years, investments have focused on crisis response, emergency centers, specialized teams, stockpiling of protective equipment and drugs, and scale-up capacity. These are needed, but not sufficient, as they are costly, difficult to maintain, products expire, and financially unsustainable when crises multiply. Prevention starts upstream, at the interface between humans, animals, and the environment. It relies on low-cost and high-impact solutions, training local actors, reducing risk practices, community-based surveillance, early reporting, coordination across sectors. These investments are affordable, scalable, and sustainable. They build long-term local capacity and empowerment instead of temporary response. They reduce the frequency, scale, and cost of crises. PREZODE shows that One Health prevention can start with a limited investment of just $10 million per country and be maintained over time at even lower costs. Health risks are systemic, and fragmented solutions are inefficient. Prevention does not eliminate the need for crisis response, but when prevention works, emergencies become rare, manageable, and less expensive. We know the limits: governance, coordination, sustained financing. We also know the solutions: cross-sectoral investment, long-term commitment, and community engagement. The economic case is clear. The scientific case is proven. The window for action is now. The best time to invest in prevention was 10 years ago. The second best time is now. Prevention is not a cost. It is the highest return investment in global health security. Support science-based solutions and the PREZODE initiative. Prevention pays off.
Every day, thousands of people work to protect the health of humans, animals, and the environment. Their efforts are crucial to preventing zoonotic diseases, which can be transmitted from animals to humans. While prevention is essential to avoid health crises, making it sustainable remains a challenge. Efforts are often fragmented across sectors, regions, and disciplines. Sharing data is essential for prevention. But when information is not connected, we lose opportunities to act decisively, from scientists to civil society and policymakers, to transform collective knowledge into preventive action. This is why PREZODE initiative is building an international platform, a collaborative space designed to connect science and society, turning local actions into coordinated global solutions. The platform will make this possible, allowing us to visualize. Through global maps, the platform makes prevention visible by showcasing ongoing projects, revealing opportunities for collaboration, reducing duplication, and enabling rapid mobilization in the event of a health crisis. Connect. Through a collaborative, multilingual interface, the platform links communities and stakeholders with scientific expertise to co-design solutions grounded in local realities. Act. Through a shared data space, the platform supports the use of multi-source data to inform early prevention and evidence-based decision-making. This platform is a living ecosystem. It only works if people actively contribute to it. Join the effort, share your projects and your data, and contribute to building prevention together. Because prevention matters. The PREZODE platform, preventing zoonotic diseases together.
As ecosystems are disrupted and wildlife is threatened, new diseases emerge from animals and spread to humans. COVID-19 was the first major pandemic of the 21st century. Maybe not the last. The way to stop this is prevention. By reducing risk, enhancing community-based surveillance, and enabling early detection through a One Health approach, balancing human, animal, and ecosystem health. This is why PREZODE exists. We are a science-driven, inclusive, and impactful initiative bringing together diverse expertise from local communities to major international players. Collaboration, scientific cooperation, science to policy decision, and data sharing are key to a healthy planet. Prevention is the most cost-efficient way to protect all health. Meet PREZODE.
Every health crisis tells the same story. By the time emergency systems are activated, the damage is already done. Lives lost, economies disrupted, budgets stretched. For years, investments have focused on crisis response, emergency centers, specialized teams, stockpiling of protective equipments and drugs, and scale-up capacity. These are needed, but not sufficient, as they are costly, difficult to maintain, products expire, and financially unsustainable when crises multiply. Prevention starts upstream, at the interface between humans, animals, and the environment. It relies on low-cost and high-impact solutions, training local actors, reducing risk practices, community-based surveillance, early reporting, coordination across sectors. These investments are affordable, scalable, and sustainable. They build long-term local capacity and empowerment instead of temporary response. They reduce the frequency, scale, and cost of crises. PREZODE shows that One Health prevention can start with a limited investment of just $10 million per country and be maintained over time at even lower costs. Health risks are systemic, and fragmented solutions are inefficient. Prevention does not eliminate the need for crisis response, but when prevention works, emergencies become rare, manageable, and less expensive. We know the limits: governance, coordination, sustained financing. We also know the solutions: cross-sectoral investment, long-term commitment, and community engagement. The economic case is clear. The scientific case is proven. The window for action is now. The best time to invest in prevention was 10 years ago. The second best time is now. Prevention is not a cost. It is the highest return investment in global health security. Support science-based solutions and the PREZODE initiative. Prevention pays off.
Every day, thousands of people work to protect the health of humans, animals, and the environment. Their efforts are crucial to preventing zoonotic diseases, which can be transmitted from animals to humans. While prevention is essential to avoid health crises, making it sustainable remains a challenge. Efforts are often fragmented across sectors, regions, and disciplines. Sharing data is essential for prevention. But when information is not connected, we lose opportunities to act decisively, from scientists to civil society and policymakers, to transform collective knowledge into preventive action. This is why PREZODE initiative is building an international platform, a collaborative space designed to connect science and society, turning local actions into coordinated global solutions. The platform will make this possible, allowing us to visualize. Through global maps, the platform makes prevention visible by showcasing ongoing projects, revealing opportunities for collaboration, reducing duplication, and enabling rapid mobilization in the event of a health crisis. Connect. Through a collaborative, multilingual interface, the platform links communities and stakeholders with scientific expertise to co-design solutions grounded in local realities. Act. Through a shared data space, the platform supports the use of multi-source data to inform early prevention and evidence-based decision-making. This platform is a living ecosystem. It only works if people actively contribute to it. Join the effort. Share your projects and your data, and contribute to building prevention together, because prevention matters. The PREZODE platform, preventing zoonotic diseases together.
As ecosystems are disrupted and wildlife is threatened, new diseases emerge from animals and spread to humans. COVID-19 was the first major pandemic of the 21st century. Maybe not the last. The way to stop this is prevention. By reducing risk, enhancing community-based surveillance, and enabling early detection through a One Health approach, balancing human, animal, and ecosystem health. This is why PREZODE exists. We are a science-driven, inclusive, and impactful initiative, bringing together diverse expertise from local communities to major international players. Collaboration, scientific cooperation, science to policy decision, and data sharing are key to a healthy planet. Prevention is the most cost-efficient way to protect all health. Meet PREZODE.
Every health crisis tells the same story. By the time emergency systems are activated, the damage is already done. Lives lost, economies disrupted, budgets stretched. For years, investments have focused on crisis response, emergency centers, specialized teams, stockpiling of protective equipments and drugs, and scale-up capacity. These are needed, but not sufficient, as they are costly, difficult to maintain, products expire, and financially unsustainable when crises multiply. Prevention starts upstream, at the interface between humans, animals, and the environment. It relies on low-cost and high-impact solutions, training local actors, reducing risk practices, community-based surveillance, early reporting, coordination across sectors. These investments are affordable, scalable, and sustainable. They build long-term local capacity and empowerment instead of temporary response. They reduce the frequency, scale, and cost of crises. PREZODE shows that One Health prevention can start with a limited investment of just $10 million per country and be maintained over time at even lower costs. Health risks are systemic, and fragmented solutions are inefficient. Prevention does not eliminate the need for crisis response, but when prevention works, emergencies become rare, manageable, and less expensive. We know the limits: governance, coordination, sustained financing. We also know the solutions: cross-sectoral investment, long-term commitment, and community engagement. The economic case is clear. The scientific case is proven. The window for action is now. The best time to invest in prevention was 10 years ago. The second best time is now. Prevention is not a cost. It is the highest return investment in global health security. Support science-based solutions and the PREZODE initiative. Prevention pays off.
Every day, thousands of people work to protect the health of humans, animals, and the environment. Their efforts are crucial to preventing zoonotic diseases, which can be transmitted from animals to humans. While prevention is essential to avoid health crises, making it sustainable remains a challenge. Efforts are often fragmented across sectors, regions, and disciplines. Sharing data is essential for prevention, but when information is not connected, we lose opportunities to act decisively, from scientists to civil society and policymakers, to transform collective knowledge into preventive action. This is why PREZODE initiative is building an international platform, a collaborative space designed to connect science and society, turning local actions into coordinated global solutions. The platform will make this possible, allowing us to visualize. Through global maps, the platform makes prevention visible by showcasing ongoing projects, revealing opportunities for collaboration, reducing duplication, and enabling rapid mobilization in the event of a health crisis. Connect. Through a collaborative, multilingual interface, the platform links communities and stakeholders with scientific expertise to co-design solutions grounded in local realities. Act. Through a shared data space, the platform supports the use of multi-source data to inform early prevention and evidence-based decision-making. This platform is a living ecosystem. It only works if people actively contribute to it. Join the effort, share your projects and your data, and contribute to building prevention together, because prevention matters. The PREZODE platform, preventing zoonotic diseases together.
As ecosystems are disrupted and wildlife is threatened, new diseases emerge from animals and spread to humans. COVID-19 was the first major pandemic of the 21st century. Maybe not the last. The way to stop this is prevention. By reducing risk, enhancing community-based surveillance, and enabling early detection through a One Health approach, balancing human, animal, and ecosystem health. This is why PREZODE exists. We are a science-driven, inclusive, and impactful initiative, bringing together diverse expertise from local communities to major international players. Collaboration, scientific cooperation, science to policy decision, and data sharing are key to a healthy planet. Prevention is the most cost-efficient way to protect all health. Meet PREZODE.
If you can just maybe
Every health
fill up the rows,
crisis.
because we will have people coming in. If you don't mind to move, to free up the first seats. Thank you very much. There will be some space for the people that are outside, because there will be people going out after the introduction. So space will free up. There is still space here. Il nous reste combien? 1, 2, 3, 4, 5, 6. Flavie? Sorry. Oui, on a 6 places. On peut faire rentrer 6 personnes. Ouais. On y va. So we're going to start. Thank you very much.
Hello, ladies and gentlemen. Thank you so much for being with us this evening. My name is Eloise Todd. I'm Executive Director and founder of RANI, Resilience Action Network International, and we are one of the partners putting on this session today with PREZODE. The other partners include PAWS, World Organization for Animal Health, World Bank Group, AVSF, ILRI, the Independent Panel, WCS, and ourselves. So first of all, a little bit of housekeeping. There will be un peu de français, a bit of English. If you would like interpretation headphones, they are at the entrance, so you can. That also applies to the people in the second room who are watching live. So our event is about preventing pandemics at source. One Health approach from local to global, the most efficient way to tackle pandemics, get them at the source. We have so many distinguished speakers and participants in the room, and we're really grateful for you making this time after a long day. To start us off, it is my honor to welcome Ministre Philippe Baptiste, Minister for Higher Education, Research and Space here in La France.
Thank you very much. Distinguished colleagues, ladies and gentlemen, dear friends, I am very glad to be here today with you in Lyon, even if we are gathered around a sobering idea. Pandemics are not an inevitability, they are the direct result of our collective choice. The data is clear, it's inescapable. 60% of all infectious disease today are shared between humans and animals. Over 70% of emerging disease stem from the complex interactions between humans, animals, and our shared environment. The COVID pandemic laid bare the fragility of a world that was obviously not prepared to face these global health risks. For too long, the global community has focused its financial and scientific efforts on reaction rather than prevention. But the next crisis is brewing today. Prevention is no longer a luxury or an option. It's a fundamental political choice. Economically and ethically, the argument is closed. Investing €1 in prevention today will save us hundreds of euros in crisis management tomorrow morning. The good news is that science has already provided the keys as to what we must do. We know where the risks lie. We have improved our understanding of how these pathogens emerge, and we have identified effective ways to reduce them. The challenging is no longer a lack of knowledge, it's the courage to act on what we know. This requires placing science at the core of public decision making. It's easy to say, it's difficult to put in place. Research cannot be an afterthought. It cannot wait at the end of the chain. It must be at the heart of our political trade-offs and our long-term investment. The priorities identified today during the One Science conference are a roadmap for this shift. What we must do is clear: act at the source in high-risk zones, strengthen early warning systems by integrating human, animal, and environmental data. We must engage local communities and support them with sustainable financing. Prevention cannot be confined to laboratories. Actual prevention takes place on the ground. It takes place where land use, agricultural practice, and wildlife interaction meet. In short, there is no global prevention without local actions. You will not be surprised to recognize that the One Health approach, breaking down silos to connect and act together. The Preventing Zoonotic Disease Emergence PREZODE initiative, launched by France in 2021, embodies this ambition. It's an international scientific bridge designed to transform research into concrete action and public policy, and with a real-world impact. France is very proud to be a driving force in this movement. We have committed an initial 25 million euros to research through the Priority Research Programme, PREZODE, and the PREACT program from the Agence Française de Développement, specifically dedicated to action in the Global South. Beyond funding, France has been a vocal advocate for integrating One Health into the international pandemic treaty negotiation currently led by the World Health Organization. Making prevention is a priority is a choice of international leadership. Today, we are joined by vital partners who are helping us scale this vision: the World Bank and the Islamic Development Bank, whose upcoming financial commitments signal a new era for PREZODE. We also stand alongside the World Organization for Animal Health and the United Nations high-level meeting dedicated to pandemic prevention, preparedness and response to come this year to ensure the dialogue between science, state, and society continues. We act together because we share the conviction that prevention is a global public good. It requires an immediate collective response. Science is here, tools are here, you are here, we are here, which means that the people and the alliance are all in place. Our choice is a simple one. Do we wait to suffer the next pandemic, the next big crisis, or do we choose to act and to try to prevent it together? Thanks to all of you. I know that you know the answer to this question, and I hope and I believe that we are one step closer to making the right choice. Thank you very much, and congratulations.
Thank you so much. Thank you. Really clear messages there. Pandemics are not inevitable. We need to have science at the heart, and PREZODE is about building that bridge. So it gives me great pleasure to welcome our second introductory remarks from Sawapak Hinjoy, President of the PREZODE Initiative. Please give her a warm round of applause.
Excellency, distinguished colleagues, dear partners, it's a great honor to open this PREZODE strategic event alongside such a distinguished group of speakers. Allow me to warmly acknowledge the Minister Philippe Baptiste for his leadership and to recognize the distinguished colleagues who will follow from the global institution, national governments, and field practitioners, who together reflect the full journey from science to implementation. As in the Minister Philippe Baptiste said that the prevention is fundamental. It's very important that right now, even though we can think that in the how we invest for the prevention. As we know that in the COVID-19 pandemic, we can see that the most often the investment that we prepare is for response. And we don't want that again. Because in the response is quite very expensive. Because in the we have to recover all the things. And even though we invest more for prevention, it means that we can save money. We can save a lot of lives. That is a fundamental. Why? PREZODE think about highlight the importance of prevention. And also PREZODE is called I'm very proud to be the part of in the PREZODE. I would like to say that PREZODE family. Because in the when we touch each other, it means that in the sharing information or in the share some kind of the learning the best practices, it's easy because in the we already know. So that's why PREZODE provide that forum to all of us. And so PREZODE is called a connecting between their side, policy and society to act on prevention. As is for in the important challenge that we are current in this current situation. Sometimes we know that we have a lot of knowledge from the scientists, and we have a lot of evidence based. But the difficult things, how we turn the knowledge into the action. So that means right now we are in the PREZODE, and so we have to committed by our policy maker, from the country member, from the international organization. So we need to turn from the commitment to implementation. We need to turn from reaction to prevention as source. This is our commitment to make and highlight the importance of the infection for the prevention. And we know that in the important thing, I think during this morning section, we learned a lot that in how we can connect it between human, animal, and environment interface. But we can see that it is not only the three sectors, but sometimes we have to think about what in the behavior, what in the civil society laws, what in the other disciplinary. So that means we have to look at the source of the list, so we can see more stakeholder. We can include the people from I would like to say that human, animal, and environmental sector is a traditional stakeholder that we already familiar with. But how we can engage a non-traditional stakeholder to be a part of our family and think together on the PREZODE and the source of how to make the highlight of the prevention. So I think right now, the PREZODE already stand ready for to connect the partners and turn knowledge into the action. Thank you very much.
Thank you so much, Saopak Hinjo. It gives me pleasure now to bring to the stage our first panel. Please give a warm welcome to Michelle Kazachkin, Laura Weber-Winzel, Shadia Wanous, Helen Roberts, and Carlos Das Neves. All have a mic on your chair. So I'm going to turn to Michelle first off. We're going to start with a bit of a global perspective from several of our speakers and then go to a bit more of a national, regional level. So Michelle, if I can turn first to you. You've had a lot of experience with these issues in various domains. And actually the independent panel spotted a gap of One Health when you undertook that exercise. What do you consider to be the key gaps today when it comes to One Health and prevention, including with respect to community engagement?
Well, thank you, Eloise. And first, good evening, good afternoon to everyone. Indeed, I'm speaking here on behalf of the independent panel. And as you just said, Eloise, this was the fact that prevention and preparedness is not just for the health sector, was one of the key points of the independent panel's report in May 2021. to the World Health Assembly. And our review at that time clearly pointed out to the fact that explicit planning was not adopted at One Health. Planning was not adopted at the top governance levels, whether globally, regionally, or locally. And COVID-19 has been unfortunate, but a vital accelerator of the understanding of the need for One Health. So progress has been made. The pandemic agreement has or is about to cement One Health into legally binding international agreements, but we all know there's still it's still unfinished business. I was pleased to see that the Pandemic Fund is taking into account One Health in its funding decisions, but there are still gaps. And Eloise, if you ask me about where I see some of the major gaps, I would say two things. One is governance, and the other is civil society engagement and community engagement. Governance, because we keep embedded in our silos at global, national, and regional levels. And we have a normative framework on One Health, but we don't know how to actually translate it into how we will work together across sectors. So we have opportunities ahead of us to discuss that. The discussion starts here today, but we will have in the future a pandemic COP as a follow-up to the agreement. We will have the outcome of the ongoing big discussions around changing the global health architecture, but the closest opportunity will be the high-level meeting in New York on pandemic preparedness, prevention, preparedness, and response. And I think that will be a key opportunity. The organizations you mentioned, Eloise, for PAWS, the elders, Rani, and the independent panel, we're co-convening into a Friends of the High-Level Meeting group, and the inclusion of One Health into the discussion is one of our key asks. On the community engagement, let me just be very brief. Clearly, the communities is about the people who know. They're on the ground, they're at the front line when an epidemic crisis occurs, and they know the risks and they know the solutions. Eloise and I have been privileged to be part of a Lancet commission that has collected across the world stories and testimonies from vulnerable communities on how they coped with the pandemic. And it's an extraordinary source of knowledge that we need to use in building resilience, because resilience is to be built in between crises, not during crisis. So we need to invest into community engagement. Thank you to Minister Baptiste for mentioning that in your opening speech. But again, here again, our funding and engagement in the communities has been too vertical throughout the history. I know that, having been, in HIV for many, many years, funding HIV communities next to TB communities, next to malaria communities, and all of those silos, of course, are, ridiculous in front of the pandemic risk. So let me end here by just saying, community engagement is really where we have to work, because it is how we translate our One Health principles into practice, really. Because our policy discussions, our technical discussions, are quite distant from the reality that people live on the ground. Thank you.
Thank you so much, Michel. Really interesting points. I'm going to turn now to Laure. So you're the senior livestock specialist at the World Bank Group. Tell us a bit about how the World Bank's evolved its approach to pandemic prevention, preparedness and response in recent years, and One Health.
Thank you. Well, the World Bank is a multi-sectoral and multi-regional institution which has the capacity to convene, gather people, finance activities, and in fact develop capabilities in different topics, including in One Health. And it's naturally that the World Bank has taken one of the leadership role in One Health implementation, which has been tracked by many records of investment at national level, but also at regional and global levels. I will just give you a few examples, chronological, maybe you will see an evolution in there. So it all started around the 70s with the onchocerciasis program, which combine activities at the environmental level, but also health sectors to curb river blindness. Then we have, of course, the avian influenza crisis with the global program on avian influenza control, but also already at this stage on human pandemic preparedness and response. And basically, this program paid attention into combining activities between human health and animal health. Then more recently, we had an interesting regional program in Africa, which was about combining or integrating surveillance activities both in animal and human health, and it's called REDICE program. And of course, the COVID-19. There was a lot of activities around COVID led by supported financially by the World Bank. Of course, most of the activities were about supporting countries in their emergency response and in the risk communication. But there was also, most of the projects had component about preventing, preparing, detecting and responding to the next pandemic. So preparing the services to do better next time. So basically it's decades of investments from which we have tried to learn, experience, lessons. And so we have shifted the way we are working now. And there's two shifts I would like to share with you today on the way the World Bank tries to operationalize One Health. The first one is fully described in a report that if you haven't yet, I would really advise you to read. It's called Putting Pandemics Behind Us. Basically, this report calls for more investment in prevention at the source. So basically shifting from a situation where we invested in preparedness and response. So don't get me wrong, I'm not trying to say we should stop investing in preparedness and response and only put on money on prevention. I'm saying that we should, in addition to emergency and response, invest in prevention. And when we do so, we do it at the source, recognizing that most drivers of pandemic emergence are in the environment and livestock sectors. So I've lost my notes. So basically, this report was building on an economic assessment done a few years before, even before COVID, trying to assess the return on investment on prevention and preparedness. Of course, we are a bank. We are looking for returns on investment. And for prevention and preparedness, the rate reached up to 88%. So it makes sense to invest in prevention and preparedness. The second shift I wanted to share with you is how we have designed the operations. We moved from a model where we were investing into a sector, or maybe into two sectors, with activities that were in line with the One Health approach. Now we really try to have a dedicated project on One Health, investing in coordination, investing in collaboration platforms, and investing in purely One Health activities. So we maybe have shifted from projects that where 5% of them were on One Health to projects in which 100% of the money is on One Health. This being said, and I will pay attention to time, we have tried to learn from this experience. We have adjusted the way we work. We are still facing a number of challenges when it comes to investing in One Health. And the main one is who wants to pay for coordination? Whether it's at national level, which minister wants to pay for coordinating with other ministers? If it's at regional level, which country wants to pay for coordination with the other countries? So we've tried different mechanisms. As the bank, we invest mainly in two ways. Either we have loans, so countries have to reimburse, or we have IDA grants for IDA countries, but they are coming from a package of grant for which country will have to prioritize on which they want to spend it. So that's why we are trying to find alternative trust funds, other grants that we can use for collaboration, for coordination, but that's still work in progress. Thank you.
Thank you so much. Turning now to Shadia from the World Organization for Animal Health. Shadia, you're right at the heart of One Health policy making. How are you responding to the increased interest in One Health? And tell us a little bit about your work to build bridges with other policy areas.
Thank you very much, first, for these important questions and for organizing the sessions. Thank you, PREZODE. Indeed, we are seeing growing political and societal interest in One Health, which is very encouraging. But the interest alone is not enough. The real change is when we translate this interest into action and into concrete investment portfolios, like you said, Laure. From our perspective in the World Organization for Animal Health, our response is structured into two main areas. The first one, we need more investment in prevention, so we support this shift. And we need to strengthen the dialogue between science, policy, and society. And to give you an example of our work on supporting this shift toward investment in prevention, we translate this into more projects to strengthen veterinary services around the world, especially low and middle income countries, because we view them as the cornerstone of prevention. So if you want to prevent at source, so you need to have the workforce equipped to detect and to respond to the outbreaks so they don't become huge pandemics. The second one is to address the issue of wildlife. It's extremely important that wildlife is recognized as component of One Health, and we need to integrate it into our surveillance system. And just next month, in May, WOAH will launch our wildlife health information system, which will be accompanying our animal health information system, which was focused mainly on livestock and other animals, but not on wildlife. So now we are completing the pictures and having comprehensive information system and surveillance to support countries. And the third one is to support and reinforce the early detection capacities at the local levels. And the minister mentioned that if you don't do work at the local levels, you will not achieve the One Health approach. And I will give an example of this work at the local level that we do with 30 partners, including CIRAD and other institutions in France and around the world. It's called ZooCirce. So it's zoonotic surveillance projects, where it's a scientific project. We support countries to understand better the drivers of the risk, why zoonotic disease are happening at the interface between wildlife, livestock, and human. And we strengthen the information and the surveillance system, and we support them to manage the risk. So this project started a few years ago with 10 countries in West Africa, and now we have 17 countries across the African continent, and we are hoping that it will expand further. And we are thankful of the scientific support from our partners and the funding from the EU commissions. The second pillar that we work on is building those bridges across the sectors. So it's not just between animal, human, and the environment, but also bringing the other sector like the education, the finance, the economics. And the second one is to move from national to regional to the global, and to ensure that those initiatives are aligned across those sectors. And here's where our collaboration with the PREZODE is really very important for us, because it helps us to link the science to the policy and to our operational system, and to ensure that research findings inform our actions and our projects, and then to scale up this prevention efforts globally. And the third one, it's about this link between science, policy, and society interface. I don't think we have enough of this. I think this gathering here, like the One Health Summit, is providing this platform, but we need more to translate the science policy engagements, and to help us to develop policy-oriented guidance for our member countries. The last one, it's all about keeping the momentum. So if we start piloting, we need to scale up the actions, and we need to sustain the financing for preventions. And we need long-term cross-sectoral collaboration. And then this is the question that Laure said, who will pay for coordination? Because coordination, it's very important, but it's hard to finance. So to conclude, our response to this growing interest in One Health is to drive this shift into more prevention, and to build the bridges across the sectors and the levels, and to strengthen the collaboration between science, policy, and society. Thank you.
Thank you so much, Shania. So we're now going to, thank you so much. We're now going to turn to a national and a regional perspective to hear a little bit about how we can, some examples of prevention success stories. And I'm going to turn first to Helen from the UK. Could you tell us a bit about UK government successes regarding prevention policy and investments, and how the UK is thinking about One Health and its relationship to other policy areas?
Thank you, Eloise, and thank you very much for inviting me here today, to Marissa and the PREZODE team. I'm very pleased to be here. So I work in the Department for Environment, Food and Rural Affairs. So we essentially have two branches of One Health. We have the animal health and the environmental health. And I've been working in One Health areas for quite a long time. So one of the things that I do is chair a group called HARES, the Human Animal Infections Risk and Surveillance Group. This has been going for about 20 years now, and is a really good example of how you build a network of people across all of those different silos. We're not just the UK, but also the Republic of Ireland, looking at food safety, animal health, and public health. Shouldn't forget them. And we meet every month and we talk about different risks that we're recognizing, whether they're international or domestic, and we come up with a risk assessment and recommendations to the risk managers. And I'll come back to talking about HARES later, because that's not the main point of my discussion here today. So back when PREZODE was first being talked about, we were trying to do something similar in the UK, but we couldn't get the money together to do it. So actually we tried to do our One Health programme through stealth more than anything else, by putting together small research programmes, all as consortia and all jointly funded by the UKRI, the UK Research Initiative. So you actually make better use of your money, and you bring together partners from not just your usual government research establishments, but from broader, more academic. So that was a really important point. We've also supported a training programme for PhD students in One Health. But success stories that we've had, I'd say two of the best ones in recent years that have come out of this research programme. One of them, when the cattle in the USA started getting H5N1, it took everybody by surprise. I think we can all say that. So we put together a research programme very quickly, building on a consortium already existing, to show that the reasons for it is that the mammary glands of animals contain an avian receptor for the virus, which is why it was so successful there. So really important piece of work that we could then build that into some of our control strategies going forward. What was it more important to do? Vaccinate the cows, kill the cows, or pasteurize the milk? And actually it's pasteurization that makes the big difference for public health. And the next one we had was on West Nile virus, where we were using a consortium of people from the British Trust for Ornithology, the Institute of Zoology, London, APHA, the Animal Plant Health Agency, who have the virologists, UKHSA, who have the entomologists, bringing them together to look for mosquitoes. We were mainly tracking Isutu virus, which has turned up in southeast England. But we also found some mosquitoes, admittedly they had been collected a while ago, 2 years ago, that then tested positive for West Nile virus. In the interim period, we had done some work with the local community to change that area, to rebuild it so that it had less floodwater. They were able to introduce some wildlife species, water voles, into that area, got rid of all the mosquitoes. So the risk of West Nile virus happening there again has been greatly reduced. But also what we're now doing, so I'm lucky enough to have our research program, and it is quite substantial. And we've got another big program called GAP-DC. This is Genomics of Animal and Plant Disease Consortium. And what we've been asking for is to be endorsed with PREZODE as a research program. It's looking at novel techniques that you can take to the field, that you can use. It's a sequencer in a box, that you can take out to the field. You can do rapid genomics and testing. And we're using it in different work packages to look at testing at the border, to do disease tracking, to do wildlife testing, to look for other pathogens in different scenarios, endemic disease, so that the farmer could use it, for example. And we're also developing the standard operating procedures and doing all of the work around how you'd get accreditation for these tests. Really important if you're going to use them. And so we're hoping that with PREZODE going forward, we can actually use the network to tell people what we're doing. So it doesn't have to be repeated by somebody else. You can have trust in that work. We can share it. And we could even use some of the network partners to give them some of the equipment to go and use out in the field as well to see if it will work. So I'm very excited about that. I think it really does cover a lot of the values of PREZODE as well, about equity, about sharing data, working in communities, about making sure you're transparent. So I'm delighted to be here today and to support this initiative. Thank you.
Thank you so much. I'm now going to turn to Carlos from the European Food Safety Authority. Thanks for being with us today. Can you tell us a bit about your collaboration with other EU bodies and the OECD, and just a little bit about your work on prevention and how you think the EU could do maybe even more?
Thank you very much, and good afternoon to all, and Monsieur Ministre and Madam President of PREZODE. First, also let me offer here a word of thanks to PREZODE. I still remember, I mean, it's a previous life of mine when Benjamin Roche at that time challenged us in Norway to join this initiative. And I have to be honest that we were all a bit jealous at the time that, you know, the Americans had predicted, and we had really nothing that could make a mark. And France took this leap of faith and invested in PREZODE that has shown that we can also master European resources to get essential work done. Now let me put again my hat of course of chief scientist of an European agency that is responsible for providing advice for the policymakers both in Brussels and in the national capitals within the Union. And of course prevention and pandemics is part of that reality. I think we will mostly agree that pandemics very often come at the interfaces of food systems. That seems to be the most plausible reason as well for COVID. I don't want to go down that rabbit hole, but if we stick to the wet markets, you know, it is food systems related issues that are bringing some of these challenges. So it is of course of concern for us in Europe. How can we be prepared for these issues? And one thing I think was quite clear, we will not get it done alone. So when you ask us what did we manage to do here, Yes, one, master a bit more of collaboration across European agencies. Sounds easier than it is, eh? It's like bridging through different ministries. It's an adventure. But okay, we got it done, and it's about, for example, bringing in environmental data from our colleagues in Copenhagen, linking to the human collected data from our colleagues in Stockholm. So we do this part. But here I think the part that is really a game changer is how to engage then with the national member states authorities who are doing this. And you can say that, well, some of them, and for some diseases, do it as part of a legal binding necessity. When you talk about avian influenza, it's a legal mandate. Member states report this data. But what we've been able to do by coming all together is to, for example, train everyone together on how the data is collected, how the data should be interpreted, to be able to, as quickly as possible, and I'm giving the example of avian influenza, to have predictions. And right now, for example, we run a system with the member states where we give you more or less a 1-2 weeks prediction, depending on how the wild birds migrations are happening, where we foresee there could be a bigger chance of a spillover to domestic poultry. And this is due to this network that has been established, collecting samples even from wild animals. By the way, one of the spots where we keep connecting this twice a year is Ukraine. So despite the dramatic situation, colleagues there continue to do this. It has enabled us to be much better prepared for what now in Europe we call these cross-border threats, which have a regulation. Let me give you only more 1.5 example. The half is the challenge. The other example, and my colleague didn't speak about it today, but we were in another conference just a few weeks about vector-borne. And it may not be the most pandemic issue, but just here to highlight as well how in vector-borne, I think Europe is waking up quicker and quicker, that this is no longer an African or Asian problem that will be brought to us by tourists returning home. And this is something that our chief veterinaries of Europe have taken very seriously. So with the help of all our chief veterinary officers of all the member states, a network is being implemented with representatives of every single European country. We got everyone on board except Malta. So, but I'll go there to get some mosquitoes as well. But every single country is now doing this, will start, this is being launched now, an organized collection, organized data analysis. Now, I said my half example, because that's the challenge, not to the PREZODE colleagues, but perhaps to the others who are at the policy making or at the advisory function. All these examples I gave, like PREZODE, have created capacity and have collected gigantic amounts of data being put together. And then very often what we do, who give advice to policymakers, is we break that apart and give sectorial advice. I advise on food, I go to the data, your amazing integrated data pot, I do the food advice, then my colleagues give environmental advice. That needs to change. That's what we're trying to do, and I mentioned the agencies have come together. So now we tell Brussels, you don't get 5 reports, avian influenza on food, avian influenza for animals, avian influenza for environment, avian influenza for, you get 1 report. Now read it and do whatever you want with it. And that comes the last part of the challenge. Even though sometimes at the advice we get together to give the advice together, we send it to Brussels, we send it to the national capital, they divided it into 5 ministries, and they make 5 different policies. So this is the last part of the challenge. We need also at that level to have integrated responses, to integrated advice based on many, among others, PREZODE, amazing integrated data collection. So that's the challenge I leave from this little European example. Thank you. Merci.
Thank you so much. What a great way to finish this panel. So can you please join me in giving our panelists a very warm round of applause as they take their seats back in there. Thank you so much. And we will welcome the second panel up to the stage. We have Marie Seper from PREZODE itself, Chris Weltzer. Please give him a warm round of applause. Nina Jamal from PAWS, Fulgence Likasi Bokamba from the Economic and Monetary Community of Central Africa, CEMAC, and Biola Badmos of the Islamic Development Bank. You're all very welcome. Come up on stage. There's also some free seats down the front. If you would like to upgrade, it is free. So please come and get your business class seat. So, Marisa of PREZODE, our keystone partner for this brilliant event. You're an epidemiologist specialized in economics and health program evaluation. From your perspective as a scientist, Marisa, what are the trends in prevention at the source, and what are the developments you've seen over the last few years that make you hopeful?
Thank you very much. First of all, I would like to say a big thank you to everybody that come today, and a big apologies for people that couldn't get into this room. We were very popular, and we had to accommodate, and the room was smaller than anticipated earlier. So thank you very much for your understanding. So to go back to your question with my scientist hat, so over the past 20 years, science had made things very clear, and we know that disease emergence is not random. It's largely driven by our activity, the way we use lands, the way we produce food, the way we move, and the way we move products and animals, and the way we interact with animal and ecosystem. In a simple world, we are the problem, and we are the risk, and we need to take responsibility at some stage because we keep on putting the risk somewhere else. And it's no different from the climate change issue, I think. And it's something that is very important to have in mind as well, that prevention and one else is done by people, and especially at the local level, and it's been mentioned a lot. So pandemics and health risk emerge at the interface between human, animals, and the environment. And prevention is acting upstream. I want to give a definition of prevention at the source. It's been mentioned, but I think something that has really slowed down the implementation and the support of prevention is probably misunderstandings of what is prevention. So prevention at the source is where humans are a risk to environment and animal, is where we impact the environment. It's also about the way we have agricultural practice and the way we control disease also in animals that can also generate different impact, but also that could be solutions. It is about prevention at the source is about taking care of our animals, our production system, our soil, our environment. It's about engaging communities, it's been mentioned a lot, in promoting and these preventative actions. And I want to emphasize also something important. Community-based surveillance doesn't mean the same for everyone as well. And it's another thing that is important to define. Surveillance is not only about tools, it's not only about diagnostics and treatments and data. It's about people being able to see the risk they're facing and take responsibility for it, evolve their practices and reduce the risk, but also detect it earlier so they can also contain it faster to prevent it from emerging and going into outbreaks, epidemics, and then pandemics. So if prevention works, we might not even need to know that something happened somewhere. And just to also share my experience as a scientist, I've been working for 20 years evaluating surveillance systems in different countries in the world. Very low sensitivity, meaning like very little things, very little data comes upstream. And in all these surveillance systems, there is vertical organization, very organized, different level of administrative steps and where the information is being shared upstream. And often, in many of them, the communities and the local people are not even in the flowchart diagram, or if they are called data provider. And I think we need to change the mindset there, shift the mindset that, as Magda said earlier, because without them, there is no data. And there is no work for us, there is no work for laboratories, and there is outbreaks and pandemics. So they need to be acknowledged and recognized as the first building blocks of a surveillance system and the first actors of prevention at the source in the field. So that's what science has learned. That's why PREZODE is pushing, and hopefully we have helped a bit pushing and changing the mindset in better understanding what is prevention at the source, with other big initiatives. And I want to highlight as well that we work also with those big initiatives like prevention pandemic at the source, PPATS, And we need to join forces because there is lots of things to do, a lot of work for everybody, and not enough funding. So prevention has been completely overlooked. For many years, I think decision makers and donors, I've thought that prevention and preparedness is the same. And so they would say they support prevention, but they finance preparedness. It's much easier to pay for infrastructure and a lab, especially at the political level, because you can cut the ribbon and it looks nice on photos, than investing in people, because this is much more abstract for them. And I will stop there. Thank you.
Thank you so much. What a great outlay of the issues. I'm going to turn to Chris now. Chris, WCS has done a lot of work to demonstrate the impact of the environmental sector on primary and secondary prevention. What are the positive externalities or co-benefits for prevention from investing in the environment?
Yeah, thanks very much for that. So WCS, just to put it, we're sort of the weird ones right here. We're the sort of conservation organization, a large global conservation organization. But building on what Marisa just said, we work on the front lines in about 55 countries, mostly LMICs. And our staff and our partners in the country are on the front lines of when pandemics happen. That is actually what we do. That's the core we do. And so if we just take COVID, for example, as an example, a lot of our conservation work is centered on markets in Southeast Asia. And actually, we were working on coronaviruses in the markets in Central Asia. So just to position what we do. But what gets there's a lot of misunderstanding, I think, or confusion. Every time you invest in health and in this primary prevention, you are automatically creating co-benefits. And those are co-benefits, obviously, the obvious one is biodiversity conservation, protecting biodiversity. As I said previously, the foundation for health for all of us. Without biodiversity, you can't have health for all. And secondly, you also have climate benefits. Depending on how you're working with the communities, and as Marisa has already pointed out, we always have to work primarily with the communities on the front lines and our government partners. So if it's well constructed, and we've learned over the decades how to do this, you're also addressing co-benefits in reducing inequities, bringing in the partners, bringing in the communities not only as data providers, but as co-owners and co-designers of data collection, and then most importantly, and Helen had already brought this up, and we have I think we talked about it previously, we have the same approach, bringing the diagnostics to the communities, be that for infectious diseases with a lab in the box and the sequencing in the middle of the jungle, but also now moving towards mercury, for example, engaging with communities and pointing out, we can actually detect the mercury in your fish, and we can tell you right away. We don't go away for 6 months, and you may hear back from us, so to say. So I think, in summary, I would say, first of all, engage civil society and the experts that are out there, right? This is a huge resource. This is tens of thousands of rangers on the front lines that are not actively involved in pandemic prevention that could. This is a workforce that is being neglected. They are already running around for hundreds and hundreds of kilometers in these front lines and collecting data. Use that data, engage them, and obviously train and so on. And the second part is everything you invest in health, first of all, it's not a cost, right? That's the other thing. Like someone had brought this up earlier. Health is not just a cost, it's an investment, it's a benefit. So just think of that as you address health issues.
Thank you so much. Such an important point there about the investment. I'm going to turn to Nina Jamal now. Oh. Nina, what's the connection for you between animal welfare and pandemic prevention, and how does your work at PAWS inform the policy priorities you advocate for in international fora, that local to global link?
Thank you, Eloise. So for PAWS, as with many of the experts and scientists in the room, it wasn't a surprise that this pandemic came from animals. We know that the majority of diseases in humans have animal origin, but it finally was a moment where this became a topic that we could talk about more broadly. And for our work, what we realized was a lot of the problems that we're trying to solve for the animals as an animal welfare organization, you know, closing fur farms, tackling factory farming, the trade of wildlife, stray animal care, and the risk of rabies, all of those problems, if we protect the animals, we also protect humans. However, when we started engaging in the international process, the pandemic agreement negotiations, so before the negotiations started, the conversation was not about prevention, it was about preparedness. Governments wanted to create a treaty on pandemic preparedness and response. It was only after experts, many of you in the room here, I recognize, and you built the case for governments to see that we need to focus on prevention as well, even if the conversation was happening in the World Health Organization and a human health organization. And governments agreed because it was the governments who cared about One Health who realized, yeah, actually One Health is important, so we can expand the scope to prevention. And it was not easy. What we noticed the past few years was a few exciting paradigm shifts. You know, we saw a shift moving away from an anthropocentric view to health, where we don't start thinking about strategies after humans get sick because animals got sick, but we start thinking, what are we doing to animals and the environment that is getting them to be sick, that is making us sick? So there was that paradigm shift. Also prevention at source, as Shadia was talking about earlier, moving away from symptom control to what is the earliest intervention that we can make before a pathogen jumps from animals to humans? What do we need to change for animals so that they're protected, so that we're protected? And a third one that was mentioned also by Chris and several speakers earlier was seeing health and health for all as an investment, not a financial burden. So we're noticing all these shifts, and what it meant concretely in our advocacy was we were not just advocating for animal welfare. We were advocating for multi-sectoral strategies where ministries work together. We were advocating for community involvement, because if we ask governments to close farms, people's livelihoods will be at risk. Communities at the interface, also animal health workers, they need to be part of the strategies because they will know what transitions are possible for them. This is where equity is. This is where we're protecting people's livelihood as well. Of course, multi-sectoral surveillance, not just to tackle early detection, but also understand the drivers. Having support for implementation through intergovernmental organizations like the quadripartite, financial support, as well, and the knowledge to policy or science to policy approach, efforts that PREZODE have been doing, regional approaches as well. And then one other thing that we need to work towards that we don't have yet is coherence across international instruments. So we've seen the quadripartite work together. We have these international organizations collaborating. It's not easy, of course, but there are also all these multilateral agreements that tackle climate change, biodiversity, trade in endangered species. Now we have also the pandemic agreement, international health regulations. There are gaps. If we think about what the science says versus what each of these instruments are asking us to do, there are still gaps, and we need to look at that coherence. So those are quite a few things that we need to think about for the next stage. To sum up, our health does not exist in isolation. If we protect animals and the environment, we're protecting ourselves. We are in a very geopolitically turbulent time right now. We cannot afford new crises. So prevention has become a necessity, not just to protect us, but because governments don't have the bandwidth anymore to look into other challenges. And One Health is a solution. It is an approach to tackle complex health challenges, and it will change the way we work for the better, which is exciting. Thank you.
Thank you so much, Nina. So before we go to our next brilliant speakers, we're going to take a little pause and watch a video from the NGO AVSF to really that encapsulates the spirit of PREZODE. So this is a vet called Samuel, preventing disease emergence at the source, grounded in local knowledge, and it raises a key question for us all. So let's watch. Sound needs to be up.
Bonjour, je m'appelle Samuel, je suis vétérinaire, responsable des projets africains au sein de l'ONG AVSF. C'est un projet de recherche-action axé sur la réduction des risques zoonotiques et basé sur l'approche ONS et mise en œuvre dans la région sud-est de Madagascar. Cette zone représente une forte biodiversité avec une interaction entre une zone forestière, zone agricole et une zone urbaine, ce qui représente une interaction entre les hommes, les animaux sauvages et les animaux domestiques.
Ainsi, l'objectif est de comprendre comment les communautés locales perçoivent les risques et à partir de cette compréhension, nous cherchons aussi à identifier des solutions ou des changements de pratiques pour réduire les risques des maladies zoonotiques et de renforcer la résilience de l'écosystème. Pour ce faire, nous utilisons des approches participatives à travers des focus groups de discussion impliquant les représentants des communautés et divers acteurs locaux. À ce stade, nous avons obtenu comme résultat une cartographie des acteurs impliqués dans la gestion des maladies zoonotiques. Et enfin, ma question concerne la suite logique du projet. Nous demandons aux communautés d'arrêter certaines pratiques comme la chasse, mais pour que ces changements durent longtemps, il faut proposer des alternatives comme des activités génératrices de revenus, comme l'élevage, l'agriculture. Et ces alternatives nécessitent, bien évidemment, un accompagnement et des ressources. Elle est donc les perspectives pour les soutenir et les financer durablement.
Très bien. Alors, je tourne maintenant vers Fulgence. Alors, comment le CEMAC favorise une coordination intersectorielle efficace entre ses États membres et concrètement, quel est le rôle de chacun dans cette dynamique collective?
Merci bien. Ah oui, excusez-moi. Merci bien. Je voudrais d'abord remercier les organisateurs et notamment PREZODE pour nous avoir associés à cet événement parce que au niveau de la CEMAC, nous considérons depuis quelques années maintenant que l'approche One Health n'est plus un choix, c'est un impératif. C'est un impératif qui s'impose à nous si on veut vaincre les questions de pandémie. Et alors, quand je parle de la CEMAC, il est important que je vous situe un peu pour vous permettre de connaître ce que cela doit représenter pour nous. La CEMAC, c'est une communauté de 6 États au cœur de l'Afrique centrale, à peu près 60 millions d'habitants, mais qui héberge le bassin du Congo. Pour ceux qui savent, le bassin du Congo, c'est une zone de flore, de faune et d'hydrographie très dense. Une zone très riche en ressources renouvelables, en ressources non renouvelables, mais aussi, en raison de son écosystème, une zone de très grande vulnérabilité sanitaire. Voilà un peu le cliché. Et alors, pour vous dire un peu davantage, les 2 dernières décennies, la CEMAC a enregistré à peu près 160 événements sanitaires liés aux problèmes et aux risques, aux catastrophes naturelles. La plupart des pandémies et des épidémies que les autres pays ont connu n'échappent pas à la SEMAC. Lorsque ce n'est pas partie de la zone SEMAC. La SEMAC a connu Ebola. La SEMAC, je peux vous donner quelques éléments assez rapidement. Ebola 2014, Ebola 2019, Marbourg 2023, Covid-19, bon, ça, tout le monde est passé par là. Variole du singe, 2022, 2025, mais ça, c'est un peu les dates bien retenues, mais il y a des épisodes qui interviennent parfois sans prendre de l'ampleur. Choléra, méningite, poliomyélite, dengue, Zika, alors j'en passe. Tout ça en raison de l'écosystème de la SEMAC. Donc, vous voyez que c'est une zone particulière où l'approche One Health s'impose à elle. Et donc, l'encouragement qui est fait aujourd'hui, que tout le monde se tourne vers One Health, est pour la SEMAC une aubaine. Et c'est pour ça que je vous ai dit qu'au niveau de la SEMAC, One Health, c'est un impératif. Alors, à cause de ces différentes épidémies et pandémies que la SEMAC connaît de façon régulière et un peu assez récemment avec Covid-19 qui a montré les limites des approches cloisonnées. Et juste après, comme cela ne suffisait pas, il y a Mpox, la variole du singe, qui a surgi. Nous avons été obligés de mettre en place un plan de sécurité sanitaire que nous appelons SécuSan, évidemment élaboré suivant l'approche One Health. Alors, au niveau de la SEMAC, la SEMAC a un certain nombre d'institutions spécialisées. Il y a des institutions qui sont de la santé humaine, notamment l'OCEAC, l'Organisation de coordination pour la lutte contre les endémies en Afrique centrale, le CIESPAC pour le renforcement des ressources humaines en santé publique. Mais nous avons aussi le PRASAC, je vois qu'il y a le directeur général qui est là dans la salle, qui est un pôle de recherche dans le domaine agricole et en fait sur les questions également environnementales. Il y a CBVIRA qui s'occupe de la santé animale et nous avons également le CEPAC qui est un comité qui s'occupe des questions de pesticides. Donc voilà, ça c'est des institutions spécialisées que la SEMAC a et donc nous avons été amenés à mettre en place un plan de sécurité sanitaire et alors qui a été élaboré suivant cette approche One Health. Alors, belle illustration de ce que Madame Laure a présenté tout à l'heure de la Banque mondiale. Et c'est elle parlait de l'appui qu'ils font et justement ce plan a bénéficié du financement de la Banque mondiale et il couvre aujourd'hui 4 pays avec la coordination assurée au niveau de la SEMAC. Comment nous assurons cette coordination? La question, oui, effectivement. Alors, la coordination, elle est assurée parce que nous avons un mandat politique qui nous permet de le faire. Et donc, nous réunissons l'ensemble de ces structures et les secteurs. Nous avons cette possibilité. Et comment est-ce que le rôle de chacun c'est en raison des avantages comparatifs. Il n'y a pas un secteur qui est déjà déterminé comme leader, mais en raison des avantages comparatifs, celui-là prend le lead et inversement, quand il s'agit par exemple des questions d'environnement, ce sera ceux de l'environnement qui prendront le lead, alors que pour les questions de santé animale, ce sera ceux de Prazac et inversement.
Merci beaucoup.
Voilà, je vous en prie.
Merci beaucoup. Désolée d'interrompre, mais on est un peu pressé pour le temps. I'm turning now to Biola Badmos. Thank you for your patience. So you're from the Islamic Development Bank, and you're a relative newcomer, let's say, in the One Health world. So tell us a bit about why One Health has become a focus for the bank and what your current priorities are.
Yeah, thank you very much, Lois. And also, I want to thank PREZODE for inviting us to this very important event, and also very important in the context of Islamic Development Bank. As you said, yes, we are relatively new, but we've done quite a number of interventions and projects that aligns with One Health. We have projects that are addressing public health. We have projects that are addressing plant diseases, animal diseases, and the likes. And importantly, our strategic framework that was recently approved by the Board of Executive Directors of the Islamic Development Bank, actually it gave room for holistic approach. And when we say holistic approach, it means approach that are interconnected. And when we look at One Health approach, it's an approach that applies system thinking approach, which allows interconnection between human, environment, and society. So we are actually on board. So the only issue we need to do from our end is the framing. We need to frame our intervention to demonstrate the One Health element. And this is one of the importance of attending this workshop, this One Health Summit. With our collaboration, which we try to strengthen with PREZODE, we believe that this collaboration will enable us to really engage with other partners that are in the coalition. Then we can be able to really frame our intervention well in line with One Health approach. So quickly, let me respond to the question about our perspective about One Health. For us at the Islamic Development Bank, we see One Health as a necessity. Necessity in the sense that it is a necessary evolution in the way we do our business. It is necessary because there are many transboundary diseases, there are many communities that are connected. Even the risk that we used to know many years ago, they are still there, but the risks are no longer isolated. They are systemic now. And even the frequency of occurrence of those risks is becoming more and more. As you could see, climate change that we used to think is 30 years intervals is happening. The variability is happening more and more. Various diseases of plant and animals, the occurrence are becoming more frequent. I think the previous speaker spoke about some of these dengue and some other stuff. We have cholera, we have other forms, Lassa fever, a lot of them are becoming rampant. So the Islamic Development Bank, we also pay attention to the, in terms of our focus. So our focus is that we will continue to implement our project in a coordinated manner, because these items that we spoke about, these diseases, they are becoming more rampant. Then focusing on our priorities at the Islamic Development Bank, I will try to quickly highlight this in 4 headings. Earlier, we said that we want to frame our intervention in line with One Health. So one area in the 4 areas that I want to highlight is policy and strategy alignment. As mentioned earlier, we are in the process of updating our policies and our strategies. So this gives us room and opportunity to really embed One Health in our policies and in our strategies. We don't want One Health to be an add-on. We don't want it to be an opportunity. We want it to be at the driving seat of implementation. Because what we have recognized is that when you implement your project in an integrated way, you are able to address many challenges concurrently, and One Health gives room for that integrated approach. Another priority that we want to pursue at the Islamic Development Bank is a partnership. This is a global issue. No one institution can address One Health, so we need to collaborate with several partners. This comes again, our collaboration with PREZODE. We will definitely strengthen our engagement with PREZODE so that we don't reinvent the wheel. We take it from where other institutions are already reached, then we can both strengthen it. And the partnership we are talking about is not just any kind of partnership. We have technical partnership and financial partnership. So we have been working with a lot of technical institutions. I want to acknowledge the presence of Professor Apollonia. We're working with ILRI in our livestock program in Africa. We believe these institutions have a repository of solutions that we can deploy to support our member countries. We are doing that with several other organizations as well. And in terms of financing, we work with several development financial institutions. We support and we work in synergy. I also want to mention another important element, which I think many speakers have also spoken about today. Training from the Islamic Development Bank, we talk about it as capacity building. Financing alone is not sufficient. You need to train the people. When we talk of capacity building in the context of Islamic Development Bank, we are talking of capacity building for our internal staffs and also for our member countries. We have colleagues who are engaging with the countries every day. We need to build their capacity so that they can speak the language of One Health when they are engaging with the countries. And also we need to build the capacity of the countries so that they can develop healthy pipelines of projects that are One Health inclined. When these strong pipelines and ready to implement projects are built, it makes it easier to implement quality One Health project on the ground. And finally, I know the time is almost gone. I just want to highlight one item that we are also doing at the Islamic Development Bank. We are a bank for the South. Many of our member countries, they need concessional financing. So we have blended finance mechanism in the Islamic Development Bank, and we also have Islamic concessional financing window, which will help countries that are debt region to really take financing that are concessional. Because when this is concessional, as you know, many countries don't put much of their budget into health, just like they do in education or even agriculture. So with this financing, with this concessional financing to the countries, they are able to take this financial support to help the countries to be able to deploy One Health approach into their activities. Thank you very much.
Thank you so much. And great to hear from you, and great to have the Islamic Development Bank on board with One Health. So we are at a micro session for comments before we close up. And I know that there's a couple of people in the audience we just wanted to hear a short comment from. If I can turn to Apollinaire Jikeng from ILRI to give a very swift comment, that would be great. And then I'm going to turn to the Pandemic Fund, Michiel. Thank you so much for keeping it quite brief.
It will be brief. 3 things.
Merci.
One, reflections from what I heard. I'll just throw some words. I think PREZODE is at a point where we can start taking stock of what has been done. I think that's really one thing I wanted to mention. There was a mention of the World Bank and the Islamic Development joining the pack. I think that's the partnership. The partnership from PREZODE is growing from strength to strength. Leadership is an important thing. Helen from the UK talked about the France taking the lead, establishing PREZODE. I think it's a movement, and we're very proud to be part of that. It's also about thinking globally, but acting locally. I think it's really important for us to put building stocks as we demonstrate progress. From us at the International Livestock Research Institute, we're really proud to be part of this. Our portfolio of work for the last 10, 15, and even 20 years has really evolved. We talk about healthy animals, healthy people, and healthy ecosystems. I think that's the approach we've taken. And some highlights. We had Priska Mugabe today. She talked about COHISA. It's really building the workforce in countries, ensuring that that is embedded for us to drive progress, but also make decisions. We have other projects that I really want to talk about. We don't talk often about pastoral communities. We have a project called Health, Environment, Agriculture, and the Livelihood. When you're looking at systems, what are we doing in the pastoral system? The One Health approach is really important for us to bring to those communities. I'm here representing the International Livestock Research Institute. We also have colleagues here from the CGIR as a bigger family. My colleague Rodrigue, who is in the back here, just raise your hand. He's leading a program in which we're developing sustainable solution for animal and aquatic food systems. And that's really where we can really bring some innovations to help us strengthen our food systems. And that's really in the context of transformation of food, land, and water system in the climate crisis. That's our strategy. And finally, I want to talk about our institutional commitment to PREZODE. We're really aligning to provide some of the human resources in terms of communication, ensuring that we're in this together. So really proud that we are committing some of our time, some of our colleagues to ensure that PREZODE, we can continue through the Secretariat. So time is really not on our side. I hope I was brief enough to offer.
That was fantastic. Thank you so much. And now to Michiel from the Pandemic Fund.
Thank you, Eloise, and thank you for your intervention. I think we are at the end of a huge day and on the eve of another huge day, so I'm going to be short. Just to mention that the Pandemic Fund is a fund created at the end of the COVID-19, and we have been established in the G20 area, and our goal is to help LMICs to get capacities to quickly detect, quickly contain, and quickly recover from an outbreak that won't become a pandemic. You mentioned clearly the lack of funding for coordination, and we are here to try to catalyze this money, not only for coordination, but also for bringing capacities in all the aspects you mentioned. We knew, but we already have a portfolio that is interesting, I think, for you to know. We already allocated 1.4 billion US dollars for 67 projects covering 128 countries with 3 rounds of calls. And this brings to a portfolio of 11.5 billion, because when you ask country to bring some co-investment, they'll do. They bring 4 billion out of these 10, and co-financing, including those from the UN agencies and banks, especially the World Bank, brings 6 additional billions. So my point here is that we can, working together, to collectively bring the capacities through catalytic financing. The Pandemic Fund is here to work with all the multilateral banks. We have several in our implementing entities. But more importantly, those projects are delivering on the ground. So our first project started 2 years ago, and we have interesting stories in our newly published annual report that you can find on our website. I will take 4 examples that could be interesting regarding recent outbreaks. Rwanda used our grants to combat Mpox and also Marburg. Ethiopia used it to combat the recently Marburg, and exchanging with Rwanda in their lesson learned. So both ministries work together on that. DRC combat, of course, Ebola, and Mongolia anthrax. Interestingly, with using the 717 metric. So I have a couple of other stories, but I'm sure you will find time to look at our website and our report. And thank you again for partners to be there and supporting PREZODE.
Thank you so much, Michiel. Thank you. So it's now my great pleasure to start the closeout of this session. So may I invite the brilliant Magda Rabalo to the stage, President of the Institute for Global Health Development in Guinea-Bissau and member of the PREZODE Steering Committee.
Thank you. Is this working? Can you hear me? Okay. Thank you, Eloise, and the speakers and the panelists for a very great conversation. I'm here to thank the Minister for Higher Education, Research and Space of France, the President of the PREZODE General Assembly, who delivered opening remarks, and I'm also going to introduce to you the new Secretary General of PREZODE before I continue. So please bear with me.
Let me start that, and then we have like a 5% for like, I think it's a more half year to see in the new Secretary General for the PREZODE, and right now she here with us. Okay, please introduce yourself.
Good evening to everyone. My name is Elizabeth Bonge. I come from Cameroon, and I am really pleased and honored to join PREZODE at this very important stage of its development. And I really hope that we will be able to move forward with the PREZODE agenda. Thank you very much.
Thank you, thank you. We wish you all the very best, and thank you for joining PREZODE. We know we are starting a new chapter, and we look forward to working with you as we move PREZODE to the next level. So, ladies and gentlemen, I'm here to give some reflections on the discussions that took place, and I'm also here to delay your cocktail. So, please bear with me. I was saying I thank the opening remarks by the Minister and then by our President of the General Assembly, all the distinguished speakers, guests and participants, our moderator, thank you. Thank you very much. We have heard a diversity of voices from science, for research, policy, finance, civil society, countries, and we are pleased with that. We know it's not enough. We still need more civil society, private sector, more communities in the room, young people, but at least we had such a vibrant diversity in this room, and I'm told some people couldn't get in, so PREZODE, congratulations, good job. What we heard today is clear. Preventing pandemics at source is no longer an option. We need to do that. It's a necessity. More than thinking of just preparedness, prevention is the way to go. One of the messages I heard was that prevention must become the core of global health security. We are still trapped in a cycle of panic and neglect, too much investment in response, not enough in prevention. Prevention is not a cost, it's a high return investment, health, climate, biodiversity, food systems, and we need to shift. That shift has been highlighted by several partners in today and in this room as well, including, for example, the World Bank. We need to stop reacting to crisis to address root causes of crisis. One second important message was about the fact that One Health is the only credible framework for us to follow. Pandemics emerge at the interface of humans, animals, and ecosystems. Sectoral approaches are insufficient. One Health provides us with a systemic and systems approach and a bridge between science and policy, a way to align ministries, sectors, and incentives to put our money where our mouth is. But there are still major gaps in governance and coordination. I want to also say here that while we shouldn't be stuck because we have gaps, we need to keep pushing on while we close the gaps. Just like roads when they have holes, and you don't stop going to wherever you're going just because there is a big hole in the road. Waiting for the hole to be fixed, you still need to continue and focus on the fact that work needs to continue. We need to improve coordination, we need to improve governance, but most importantly, we need to implement the things we already know they work and push forward with that. Otherwise, paralysis will take care of us, and no one will see the impact of this great framework that One Health is all about. A third message: science exists, but it's underused and underfunded. I will even add it's misunderstood. We live in a era where people who understand very little about science talk much more about science than those who actually understand. And they speak about science in platforms where they have a huge audience. And we need to make sure that we fight disinformation, misinformation by placing science where it should be. Science is should no longer be confined in libraries, in universities, in schools. We need to take science to the streets. Just as rap is on the street, we need to take science to the streets so that people can understand a lot of. We talk about it, only us understand ourselves. 20 years of research have generated robust evidence on prevention. We know what works: surveillance systems, environmental prevention, community-based approaches, yet funding for prevention research and implementation remains insufficient. And this is where I loved to hear Pandemic Fund saying that they can fund coordination and support. Governance Islamic Development Bank, who is coming also with big support. We need to educate countries about concessional loans. It's not that bad. So they really need to make sure they adventure into that. Of course, cost of money, particularly in low-income countries, is quite high, but concessional loans can help bridge the gap to support funding those activities that we are not yet able to in order to support research and implementation. We have a strong need to better connect science policy to action, and we know communities are central to success. Prevention happens locally at the source. Marisa reminded us about that. Communities are not beneficiaries. They are co-actors of prevention. We have seen a short video from Madagascar and demonstrated us that solutions work when they are co-designed, and behavioral and livelihood transitions, of course, need support. Governments must enable and invest in local action, governments and partners as well. The fifth message is environment is not a co-benefit. It is a determinant. We are learning increasingly about how the environment impacts our health and our ecological system, but we need to work even more with environmentalists and integrate that into the work that comes from the health sector. The ecosystem integrity reduces spillover risks, and environmental action delivers multiple benefits: health security, climate resilience, biodiversity protection. Yet, there is underfunding and poor integration in health strategies. Still, we are not talking enough with the people who can make our work easier, or they are not talking enough to us from the health sector so that our collaboration becomes stronger and the work is easier. There is no prevention we can achieve without integrating the environmental sector. You are closer to your glass of wine. Scaling up requires governance, financing, and partnerships. National success stories do exist, but scaling remains the challenge. We have identified that we need stronger multi-sectoral governance frameworks. CEMAC gave us a very good example of regional coordination that needs to be improved. We need better financing instruments, but also mobilize domestic resources to complement international support. Development banks and donors are ready to act, but they need bankable, integrated One Health approaches, and PREZODE can help in doing this. PREZODE's added value clearly emerged today, not only by the room that was full to capacity, but also by demonstrating that we can connect science, policy, and field action. We can support countries. We can build a global community of practice. PREZODE is a platform to operationalize prevention at scale. This is my second term in the steering committee of PREZODE, and I want to believe that the potential of this initiative is immense, it's enormous, and we just need to continue getting the support of the French government, but also Carlos has left, other governments within Europe and outside Europe to move PREZODE to the next level. The real question is, we know the risks, we have the science, we have the tools, but how do political will and collective action can really make things happen? Political commitment these days is, I was thinking the other day that political commitment becomes just like maybe fuel these days, very rare, or something that is all over the place but not enough to make things move forward. Everything needs political commitment. Everyone commits politically, but then from there to action, we have challenges. So we need to move from commitments to implementation, invest in prevention now, because preventing the next pandemic starts long before the first case. And it depends on the choices we make today. Of course, the choices after this is for Eloise to come and then tell us the next steps, and for you to be connected with your cocktail, and for me to thank you for your attention.
Magda. We're going to hear briefly from Mathieu Legris, and then it's cocktail time.
Good evening, and sorry for the few minutes you're going to wait more before the cocktail. Well, very hard to speak after Magda and her excellent conclusion. A few words about AVD's ambition on One Health. It is to support concrete actions on the ground and to help translate this approach into public policies. That's why the French government through AFD has been investing in PREZODE since 2022 with a total contribution of 25 million euros. Together with French research institutions, we focus on PREZODE's operational dimension and intangible field-based action. And the video from Madagascar clearly shows the kind of initiatives we support. And we are currently funding this type of action in 16 countries across Africa, Asia, and Latin America. And we're very happy to see newcomers in the partnership, like the Islamic Development Bank, and very happy to have the World Bank too in this great partnership, which is PREZODE. We strongly believe that the local level is the right scale for first risk identification and prevention, working closely with rural communities. And looking ahead, the key challenge, in our point of view, is our collective ability to scale up these pilots or living labs approaches into more systematic action. This requires two things. First, strong public policies, and second, increased investments. Regarding public policies, I think that today's event shows that big progresses have been made in the science policy dialogue on One Health. However, at country level, and I believe this is true everywhere, much remains to be done to mainstream One Health principles into sectoral policies, especially in agriculture, and to ensure effective cross-sectoral coordination. And for example, land use planning policies are essential to reconcile biodiversity conservation, sustainable agriculture, and sustainable livestock management. Regarding investments, we are all here convinced that investing in pandemic prevention is economically and socially sound. When it comes to food systems, we know that their hidden costs are significant for health, but their environmental costs are just as high. In this sense, investing in sustainable food system delivers a triple dividend. First, it helps avoid the cost of health crisis. Second, it preserves natural capital, which is critical for the entire economy. And third, it creates sustainable jobs, both now and in the future. This investment does not necessarily require entirely new funding. We know resources are scarce. Part of the solution lies in realigning existing investments on One Health approach towards greater sustainability. And in practice, key actors in implementing this approach on the ground include those providing extension and advisory services, as well as vocational training. Farm organizations also play a crucial role, as does conservation work, as highlighted by Chris. So basically, financing One Health means investing in awareness, capacities, and in new methodologies. It is feasible because it's necessary. Thank you.
Thank you so much. So, colleagues, I just want to ask you to give one final round of applause to our brilliant speakers, all the partners that put so much into today, but a particularly special thank you to the brilliant partners of PREZODE who are just legendary, and it's so great to meet the new Secretary General. So thank you, PREZODE. And if I can invite you all to take the cocktail outside, you've definitely earned it after your long day, and if I can invite all the speakers to give us 1 minute of your time to come up and get a photo, that would be great. Thank you so much, everyone. Have a lovely evening. See you at the cocktail.